Welcome, everyone. Thanks for being here at our webinar. I'm going to give it a couple more seconds to let people join, and then we'll get started. Okay, I think we are ready to get started. Thank you again for attending our webinar today. I'm Jenny Gaines. I'm the Director of Programs and Services at F.E.A.S.T. Thank you to the Emily program for sponsoring our webinar today. And our topic is how to stay on course in recovery while transitioning between levels of care. And we're fortunate to have Dr. Jillian Lampert here to share her expertise on this topic with us. And before she gets going, we're going to cover a couple of housekeeping guidelines. Please keep your cameras off and yourself muted during the presentation, and use the chat box to ask questions throughout the presentation. And at the end, or possibly during, we will get to the answers to your questions. And without further ado, I think we will get started and hand it over to Jillian.
Great, thank you so much. I'm so excited to be here. Let me get my slides shared. Right, does that look like it should, Jenny?
Perfect.
Excellent. All right. Well, thanks everybody for being here. I'm very hopeful that the next bit of time we can spend together, I can answer your questions and leave you with some useful information. So I want to tell you a little bit about me and why I'm talking about this topic, and a little bit about what I do in the world. So I am Jillian Lampert. I'm the vice president, one of the vice presidents at the Emily program, and I oversee a lot of communications related activities. I joke with people that what I do for work is talk. I talk to anybody about eating disorders. I talk to anybody that will listen to me. I have been in the field of eating disorders for 30 years. I am a dietitian by training, so I've seen people as a dietitian clinically for a very long time. I have a PhD in nutrition and epidemiology, and I am an adjunct professor at the University of Minnesota, where I teach a undergraduate and graduate course on the management of eating disorders. So I also sort of joke that my work is eating disorders, my hobby is eating disorders, my side gig is eating disorders. I am super passionate about helping more people know more about eating disorders, how to help people, what to do. And so I'm hopefully going to share some of that with you that's helpful for you. I also am recovered from an eating disorder. I had an eating disorder in high school and college for 7 years, a long time ago, before there really was much in the way of treatment. And so consider myself very lucky to have survived that eating disorder and to have thrived after. And I find some of the research that's been done in the last 15 years really looking at temperament traits and what we know about what makes some people genetically susceptible to an eating disorder is really meaningful information to me, because I think in my recovery, one of the things that's been really helpful is kind of using the traits that probably were really set me at risk for developing an eating disorder, been able to use those traits sort of for the good and to help me find joy and satisfaction in my life and my career, and sort of channel those traits like persistence and high noticing of details and some perfectionism and those sorts of things that some of you may be familiar with, and loved ones that you have that struggle with an eating disorder, that they really can be traits used for the good. And so that's what I talk to clients about as well, and families, that an eating disorder is a terrible illness to have, very difficult illnesses to experience, very difficult to be a family member, to love somebody with an eating disorder. I understand, sort of from a professional experience and a personal experience, how difficult that experience is, and how much support people need. One of the founding principles of the Emily program is community, and helping people establish their community of support, and how they will continue to build that and grow that as they sort of progress through recovery. And families and friends are such a huge part of that. So it relates to today's topic, really about how to stay on course in recovery while transitioning between levels of care. So I've worked in lots of different eating disorder levels of care. I've worked in lots of different settings, in bigger programs and little programs, in different parts of the country. And I really can attest to the idea that if people can get the care they need for long enough, with the intensity that they need and the support they need, they can thrive. And so many situations are not set up to facilitate people getting the care that they need for long enough with the intensity they need, in a way that really helps them to do that. And one of the areas I see this most keenly is when people transition between one level of care and treatment to another, whether it's going up or going down or across. That I use a ladder analogy that I always think about, that treatment for eating disorders is structured in most parts of the world sort of like a ladder. You have some lower level intensity services and some higher level intensity services. So outpatient would be that lower level intensity service where you may be seeing a provider once a week or twice a week or 3 times a week, whatever that outpatient level of care is, all the way up the ladder to a 24-hour care setting, whether it's an inpatient setting, maybe a residential setting. That whole ladder of care, which may involve an intensive outpatient program, may involve a partial hospital program, may involve a residential and inpatient rungs of the ladder that are separate programs. That, like any ladder, if we try to skip a bunch of steps, some bad things can happen. And so I think in eating disorders care, I think a lot about that, because there's so many influences on how effectively we can go up and down the ladder. There's external influences like insurance coverage that can sometimes dictate what rung of the ladder somebody gets to be on, and then what the next rung of the ladder is. And sometimes there are some really big steps between that. So I'm really aware that in my sort of ideal state analogy of, you would be able to go up the ladder and down the ladder when you need, and taking every step in a sort of as safe as possible kind of way, and as supportive of a way as possible. May not be actually happening for everybody, but I really hope that it can. And I continue to work, I think, in my day-to-day work for a world where that's possible. I was reminded of this ladder analogy this past weekend. I was hiking, and I was going over some rocks along a river. And at one point, the rocks, there were some really tall rocks, and you had to use a ladder to get from the lower rock to the higher rock. And the ladder had a rope next to it so that you could hold on to the rope and the ladder. And then you had to sort of like swing off the ladder over to the next rock, and you could use the rope to transition from the ladder to the rock. And as I was climbing, and I got up to the top of the ladder and was reaching for the rope to make the transition, I felt the fear in that moment of, I really am going from something that feels relatively safe, climbing up this ladder, to now taking the step off the ladder and trying to figure out how I was going to do that safely. And as I was thinking about this talk this morning, I was reflecting that there I was climbing up this ladder on a rock next to a raging river, that if I would have fallen into the river, bad things would have happened. And I felt safe on the rock on a ladder, which was not a terribly safe place to be, but I felt safe because I had a guide for the hike. My husband was behind me, so I had family, I had a guide, I had a professional that was helping me negotiate this ladder. And I was just thinking this morning, wow, that's sort of how treatment and going between levels of care is, that we hopefully have support, our loved ones supporting us, as well as some sort of professional who's been there before. And maybe it's not a clinical professional, maybe it's somebody who's been there before a lot. And how important it is to have somebody who has experience transitioning off the ladder, up and down a level on that ladder with us along the way. So I'm hoping that this is a little bit like that hike, and that you get some tools for how to feel as safe as possible during that kind of scary time when you're going from one sort of scary place to the next. So I'll be thinking about my ladder, and hopefully that'll make some sense as we go along. So I want to dive in with just the idea of, what are the transitions between levels of care? What are the challenges with those transitions? There are a lot. It's a little bit like a roller coaster. if you are, if you've had this, been in this situation where you have a loved one in a certain level of care, and it's the next level of care is coming up, your loved one might not be ready to go to that level of care. You might not be ready. Your loved one might be ready. You might be ready. It's all sorts of possibilities exist just in those first couple bullet points. You might be ready and not ready in the same day. Your loved one might be ready and not ready in the same day. And so that sort of sense of how ready am I can change minute to minute. The treatment team from one level of care to another might be new. The treatment team between one level and another might not be new. And both of those can be a challenge, that there's beauty in each of those opportunities, that if you have a treatment team that is new and your loved one has to switch their treatment team in between level of care, that can feel challenging. And it can also feel really like a step of progress, that like, okay, I'm moving from this to this, and moving to this means that I have a new team to support me. And that's okay, that it doesn't have to be the same all the way through, that there's opportunities for growth and learning each time we change something. And a lot of eating disorder recovery is about dealing with change, right? Dealing with discomfort. I think about the amazing research that Dr. Laura Hill has worked on for a number of years, and the work that she's done a lot of that temperament trait work, and the way that she thinks about how uncomfortable eating disorder treatment can be, how uncomfortable recovery can be. And she has an exercise where she has people write with their non-dominant hand, and how uncomfortable it is to write. I'm a right-handed person, and so writing with my left hand is pretty uncomfortable for me, that I don't feel like I'm very proficient. I don't feel like I'm communicating well, and it takes more time. So I feel slower, and I feel like I have a barrier in front of me. Those experiences are pretty analogous to how we feel often as people go through the recovery process, whether we're the person experiencing it or a family or friend around them. Another challenge is that the person who's transitioning between levels of care might have significantly more time at home, which is amazing and wonderful and so exciting if you've had a child or a loved one in a higher level of care and they step down, which means now they're sleeping at home and they're able to be home more and they're able to go back to other activities. Super exciting. And it's a challenge. It's like jumping in a kind of a big way from the ladder into the next thing. And even if the next thing feels pretty known, in the middle of eating disorder treatment, everything feels new. Everything feels a little or a lot difficult. That change is hard. Often for humans, no matter what, change is hard in the process of recovery. The person with eating disorder may have to return to school or other activities, maybe athletics or work or extracurriculars, and they may be super excited about returning to those activities. You may be super excited about them returning to those activities. And there's still new challenges. There's still new and different changes along the way. They or you may need to pack more meals. You may need to have more involvement in the day-to-day sort of feeding and nourishment of that person, versus if they were in a higher level of care and the treatment staff were doing that work, or maybe you were sharing that work. They may have more independence. They may need more supervision. There's always opportunities for more practice. And I have said this to clients for years, that recovery is really difficult. And one of the amazing things about eating disorder recovery is that while eating disorders certainly aren't just about food, right? I often will say eating disorders aren't about food. And they sure are about food when the food shows up, right? That's a dialectic, that when food shows up, there's a lot that comes up. So having more opportunities for practicing that, the great thing is you get to practice it, and then a couple hours later, you get to practice it again. And if it doesn't go so well, you can move to the next one and let that last one go. That we get, if you take meals, 3 meals a day, 7 days a week, you have 21 times to practice during a week eating a meal. And then you have a whole lot more opportunities to practice with snacks. So there's a lot of opportunities to practice. And there's a lot of opportunities for the eating disorder and the eating disorder thoughts and behaviors to step in, to slip in, to sort of come in underneath. And that means more unexpected things might happen. You can see on this slide, they will happen, not just might, things will happen, right? And it may feel like things are going well, it's solid and things are going great. And we might underestimate the need for really having a lot of vigilance and persistence to maintain that recovery. And the transition may have been premature, that if an insurance company was involved and treatment decisions were thus, impacted, and they were different than what you might have wanted. Maybe I'm climbing up that ladder and I really wanted the rope to be there, but oh, the rope broke and it's not there today, and now I have to get off the ladder anyway. That really is an opportunity for the eating disorder to kind of come in and throw people off balance. There may be less support or less engagement at a time you really need the support and engagement. And there's more, right? You may be thinking of things that come to mind to you as you think about all of the challenges that happen between levels of care. And I have this long list because I think about all the times that I've talked to folks who are really excited to move from, maybe they're in residential and they're stepping down to partial, or they're in partial and they're stepping down to IOP, or they're in IOP and they're stepping into outpatient, and they're excited about being able to go back to school, or they're excited to being able to go back to college, or go back to that part-time job, or go back to competing in cross-country running, or whatever it is. It's really exciting. And we can sometimes lose sight of, in the excitement, there is a sort of underlying opportunity to make sure that we're doing everything we can to help that transition be a positive, enjoyable, beneficial experience, and try to mitigate as much of the risk as possible. And we can't get rid of all of the risk. So I love this graphic because I think it really underscores what healing and recovery from an eating disorder is all about. We want it to be, our expectations and our desire is that it's nice linear progress over time and things improve. The reality is that it's much different, right? People have dips and they advance in recovery, and then they fall back, and then things go pretty well, and they can go pretty well for a while, and then it drops down again, and it goes all over the place. And that's normal. That's how it goes. That's actually what reality in recovery looks like. And really accepting and embracing that is helpful, if nothing else, because it reminds us that this might be a lapse, this might be a slip, this might be a relapse, and we can move forward and keep making progress. It doesn't have to be linear. It's probably not going to be linear, and that's okay, that we're going to hang in there. So some tips on supporting your loved one that are really informed by people who have experienced an eating disorder and by clinical experience, that there are lots more, and 13 is not a magic number, but I think this is a helpful compilation of different tips. So accept your limitations. You can't make your loved one want to get better, right? I've talked to lots of parents who really want their loved one to understand how much better recovery would be, how much they want them to get better, how much things would be better if the eating disorder were gone. But we can't make people want to get better. We certainly can support them. We certainly can put in all kinds of supports around them to propel them towards recovery. And it's okay if in the moment you want them to get better more than they want to get better, that you can keep wanting them to get better and they'll come along, that process will happen. But try not to get frustrated if you're not sharing the same sort of experience of that desire for recovery. Really importantly, I think I'm as I go through this list, I think you're probably mostly all doing all of these things already. We try to do these things as human beings. So I find the list just helpful to remind us of the things that are really helpful. So accepting your loved one for who they are. Remember, they're an individual. They're not their eating disorder. Eating disorders can be vicious. They can be so domineering. They can be divisive. They can be so many things that are really difficult to manage, to work with, to live with, to deal with, to experience. And they're not your whole loved ones. Eating disorders get people to do things that they would never typically do in a well state. Their brains are not working in the way that they will in recovery. Their brains are not working as well as they will when they're well fed, and as well as they will over time. And so accepting that, here you are right now, and you know your loved one best. This is your child, you know them better than anybody else, and you know who they are. And really hold on to that, accept them for who they are, and help them to sort of remember that as you go along. A combination of sensitive and firm, I think, is a golden moment. It's certainly when in treatment, as a treatment provider, I see our staff be sort of most successful when they're really sensitive and they're also really firm. I remember training a new dietitian once a number of years ago, and we were doing a mock meal, practice meal, where we were, some of us were clients and some of the staff were acting as staff and getting the meal accomplished. And there was a new dietitian who was trying to get one of our people who's role playing a client to take more on their plate. And the dietitian was super friendly and so sweet and so supportive. And the mock client was putting nothing more on their plate. And I said to the dietitian, we did a little timeout, and I said, I see that you're being so sensitive and supportive, like you understand what this person is afraid of. You are being so supportive. And I also see that there's not any more food going on that plate. And we've all agreed that the meal plan needs to be, X. And right now it's not there. And so how can you add something to your sensitive, supportive approach to help the client actually get the food on their plate? And she thought about it. She said, well, I don't want to be mean. I don't want to be, I don't want to be overly forceful. And I said, do you have any siblings? She was like, yeah, I have a younger sister. And I'm like, okay, I bet you get your younger sister to do things that your younger sister doesn't want to do, that is good for your younger sister to do. How do you do that? And I bet that your younger sister loves you the whole time, even if you're kind of fighting a little bit, even if it's difficult. But what would you say in your best big sister approach to get your younger sister to do this? Try that kind of mindset with this client who's we're trying to get this meal plan accomplished. And so she sort of put on her professional big sister voice and was able to really help the person get the food on their plate, because she added firmness to it. She had this wonderful, loving sensitivity and an expectation that it was going to happen, because it was the thing that needed to happen. And she said that was so helpful. Like, I just never realized how helpful my experience as a big sister would be. So I think it's that balance of sensitivity and firmness. Certainly complementing strengths that have nothing to do with appearance and nothing to do with eating or food. That is really, really important, right? We live in a culture where comments on appearance are so common and comments on other things are less common. So you can help your loved one by making comments on things that have nothing to do with their appearance, nothing to do with food, nothing to do with eating. Really complimenting their strengths around, I see how hard you're working at that thing you're doing, whatever the thing is. And that's really impressive. There's a lot of nuance around complementing strengths that I won't go into in any great depth, but even saying to somebody, I'm proud of you, which can be lovely and affirming, can also be heard as by somebody who's trying to do something different as, okay, it's external. I'm doing this to make my mom happy or my parent happy. That compliment could also be, wow, I can imagine it, how it would feel to have accomplished that. That's so cool. That's such a cool thing that you did. Really putting admiration in there with your pride to complement that strength. And then the number 5, I think, is probably the most important thing on this entire list, which is seek support for yourself, right? It's part of what you're doing here, seeking support for yourself, to make sure that you are able to stay nourished and strong and supported as you are helping that person up and down the ladder. Number 6, respecting how and where your loved one wants their eating disorder discussed, right? We talk about, I remember when I was ill with an eating disorder, and my mom was talking to a friend about it, and I was super upset. And I just said, like, why are you talking to your friend about my eating disorder? I don't want, and I was really mad, and I was probably unkind, and I am sorry for that. I'm sure I was unkind. And so we were able to, after a little fight, we're able to have a conversation that I really understood that my mom needed to talk to somebody about the fact that I had an eating disorder. And it was really difficult for me to know that she was talking to people that I didn't know what she was saying, and that I felt blamed for having an eating disorder. And I felt it was my fault. And I felt like I was doing something terribly wrong, when I internally felt like I had this terrible thing happen to me that I was trying so hard to do something about. And so my mom and I agreed that she would ask me before she talked to somebody else about my eating disorder. And it was great. It worked for the next bunch of years. We did that. And even when I was in my career as an eating disorder clinician and talking publicly about my recovery, and was on videos and YouTube things, and quite publicly. My mom said, "Can I talk to my friend about what you're doing?" I'm like, "Yeah, now you can talk to anybody you want. You can say anything you want about me, because I'm talking to everybody about it." So, but really respect how and where your loved one wants that discussed, and have that conversation ahead of time so that you know how to support them and that they know what to expect. Uh, Number 7, ask your loved one how you can support their meal plan or how they can help you support their meal plan, depending on where they are in the process of recovery. You may be doing a lot of the work with their meal plan, or they may be doing more of the work. How can you support each other? Having that conversation, not during a meal planning time, not when there's food around. A lot of the important conversations need to happen when there's not the stress of food around, so that we don't have that extra element of fear and anxiety that the eating disorder brings. Uh, Plan non-related food activities for times right after meals. You want to redirect that attention, the energy. It's a movie, it's a walk, it's a meditation, it's time with the dog, it's drawing, it's knitting, it's whatever your family does. Have some fun built in there that will help really shift the experience. Number 9, as much as possible, try to focus on the other things in life. There's so many other things in life, right? And the eating disorder starts to overshadow so many of them, to really protect and preserve those pieces that you can talk about without having to have the eating disorder be in the room at the table. What else can you focus on? What other things don't have to bring the eating disorder in? Number 10, super important, be a good role model around discussing food, body weight, your own and other people's. That I know lots of people who experience an eating disorder, whether it's a loved one or the person themselves, become really amazing role models for really role models and advocates for having positive relationships with body, with self, with weight, and not talking about other people's appearance and body weight in just lovely ways, really helping to reframe the conversation about the person themselves, not just their appearance. The world is so full of messages about what our appearance needs to be, should be, can be, all of those things. It's a great opportunity to be a good role model, and it really is impactful, not just on your loved one, but on people around them. Your loved one's friends. Like if you have a child with an eating disorder and you're role modeling a different way to be with body and food and eating, their friends will see it, and you're able to sort of spread some prevention and some goodness into the world, just by the way you talk about food and eating, and using whatever phrase fits for you. We often encourage families to say, in this family, here's how we talk about appearance. Like in this family, we don't comment on other people's weights. In this family, we don't make fun of other people's appearance. In this family, we don't talk about diets. Well, however you want to do it, but really having a way that you and your family and your support system talk about it. And you can be a great role model for a change that really can ripple out in a pretty amazing way. Set an example, participate in family treatment if it's recommended, participate in family therapy, in talking openly about your feelings, actively identifying and resolving problems, ways of really saying, like, we're gonna, walk this talk that we're doing. We're gonna practice, because eating disorders present an opportunity for all of us to learn how to manage our emotions and our experience and our relationship with our bodies and food differently. Every new employee that starts a family program that doesn't have any personal experience with an eating disorder, after a couple weeks says, wow, this is just sort of different. Like how we talk about feelings here, and how we talk about our bodies, and how we don't talk about our bodies and other people's bodies is refreshing. It's just different. So we have an opportunity to be examples for that. And then the last couple, convey that you believe in your loved one, that it's so valuable for somebody struggling to know that other people believe in them, even if things aren't going well, that you, who loves your person so much, believe in their ability to do this. They can do it. And then recognizing that recovery isn't linear, just like that last picture. It's seldom logical, seldom linear. If you try to apply logic to it, it's probably not going to get you very far. It really is a process that takes time. So to sort of sum up some of those, like, transitions are hard. They just are. And if you have a loved one in a higher level of care that's stepping down, or a level of care and they're stepping up into more intensive treatment, maybe you're doing outpatient treatment and you need to step up into a 24-hour care program. Maybe you're going from 24-hour care down to outpatient, and maybe it's going down the next rung of the ladder. Transitions are hard. If you're going from 24-hour care to outpatient, you're skipping a bunch of steps on that ladder. That's a tough descent down the ladder. If you're going from the bottom all the way to the top, that's a tough ascent up the ladder. Ladders are meant to be, rung by rung. So transitions are just hard, even if you're going exactly one rung at a time, because change is tough. Persistence is key. I again love the research that shows that people who have that high persistence trait are more likely to experience an eating disorder. And that trait is going to be really helpful in recovery, because persistence is that trait that gets us to do stuff even when we're uncomfortable, even when other people are kind of done doing the thing, that it really just keeps us going. It's the thing that also makes it hard for some people to remember that they need to eat and that they're hungry, and it makes it a little easier for some people to ignore their bodily signals of hunger and fullness, or to have those signals be a little quieter. And it can help us get a lot of stuff done and accomplish a lot and be really successful when we sort of set our mind to something. So persistence is key. Let's use that trait for the helpful side. Vigilance is really important, but so is balance. So being really attentive and balancing it with, yep, we're going to pay close attention to this and we're going to have fun. We're going to really work hard at this, and we're going to let ourselves slip up. We're going to have times when it doesn't go as well, and that's okay. We're going to have a balance of that. So we're going to be cautiously, carefully attentive, and we're also going to have a balance that we certainly can't control all things. Which leads me to slips will happen, that things will go wrong. They just will in eating disorder recovery. They just will in life. And it's how you deal with them. That's key. It's really, how do we deal with what happens, which is part of the way to manage slips and lapses most effectively, is to have a plan for what you'll do before it happens. So I often use the language of like, what would future me want me to have done right now? What would future me want current me to have planned right now to make this future thing easier? And so it taps into that, sometimes that planning trait, that like wanting to know what's going to happen kind of trait, that you can plan for lots of stuff in the future. Might not always go quite as you planned. That's that balance piece. But future you will really appreciate that you made a plan that said, if a lapse happens, here's what we're going to do. If that meal doesn't go well, here's what we're going to do. If the individual is eating sort of purges, here's what we're going to do. If the person skips meals, here's what we're going to do. If we are struggling with over-exercising, here's what we're going to do. Whatever the experience is, if that person is struggling going to school, if the person is struggling in whatever ways that they're struggling, what are we going to do? What are we hoping we might consider doing? So I can help future me feel more equipped. So how we deal with those slips is really important. And we can't plan everything. So it's okay if you didn't plan everything and something happens and you have to figure out what to do. But you have lots of skills to apply to how that can be managed. And then that repeat refrain I have, that lean into the temperament traits that are being taken advantage of the eating disorder, and use them in the recovery process. Because persistence is great. Attention to details is great. Ability to stay on track, on course, on a plan is great when it's not being taken advantage of by the eating disorder. So some overall treatment pitfalls and some guidance, and these are informed by parents that we've worked with over the years. Some pitfalls that are going to set you up or be a difficult experience: not getting enough information. If you feel like you're not getting enough information from your treatment team, from your loved one's treatment team, ask. Don't be afraid to ask. That you are your person's primary support system. You need the information. So ask, and don't be afraid to ask. Having overconfidence with progress, like it's great to celebrate, but the guideline there, the caution is be resolute and vigilant and celebrate. Like a lot of times, I used to work with somebody who had a really hard time celebrating anything, because he was afraid that if we celebrated it, it would go wrong the next time, or that we wouldn't work as hard the next time. And so we used to sort of rib him a bit for like, we can celebrate, it's okay. It's like, what is it that makes celebrating hard? And we talked about it and realized that he was really superstitious and worried that if we celebrated too much on some accomplishment, that that he was superstitious that something would go bad the next time. And so we talked that through, and he was able to be a little bit more celebratory, while also we were able to understand why it was so hard for him to celebrate. Another pitfall, not using time in treatment to try challenging things. That treatment, take risks and encourage your loved one to take risks and to try things that are more challenging when they have the support in treatment. If somebody's in a day program or a residential program or an inpatient program or even in an outpatient session, encourage them to use that time in treatment to try the hard things. That I've told so many clients at this point, if if pizza is a really hard thing for you to eat, if you can't eat pizza here with me, and I understand why pizza is really hard for you, and I got a whole slew of books on my shelf that explain why pizza is hard and how I can help you to get the pizza. If we can't tackle pizza here, I don't know how you're going to tackle pizza out there without support. You need support, and practice that. If you have the opportunity, if your loved one has the opportunity to be in treatment, practice the challenging things, do the hard things. There are people around to help support if it doesn't go well. Another pitfall is not soaking up as much information as you can. It's sort of tied to the like ask. Don't be afraid to ask, but keep learning as much as you possibly can to help your loved one, and ask them, how can I help you? What things are you finding helpful? If your loved one is in treatment with a treatment team and maybe they're in an intensive program where they have other staff around, ask them what's helpful for that. What does the staff do that's helpful? Like glean little tidbits from other folks. And then the last one's so important, not taking care of your own needs, like becoming overstretched, exhausted. We all get there, but really allow yourself the time for self-care. This is that quintessential, put your own oxygen mask on before helping your loved one. If you have a partner, tag team your child's recovery. If you have a friend, if you have family members, however, really seek out your own support and in your own treatment if you need. If you're really struggling with anxiety or depression, or substance use, whatever it is, get help. You deserve help too. You deserve the support you need, and you'll be able to help your loved one be more effective in their recovery as well. Couple other sort of specific pitfalls I wanted to add in. Forgetting parts of the meal plan when your child's not in programming. A lot of times we'll have families talk about like, oh, we have the 6 hours a day that this person's in PHP, and we get these foods in, and then when the person's not in treatment, we miss a few things, and we don't quite get those pieces in, but like you got to get them in. Meal prep, create a list or schedule of meals outside of programming. This is when that planning gene comes in really handy to make sure that you're getting all of those pieces in, or you're working hard to get all of those pieces in. Other pitfalls, particularly early in a transition from a higher level of care to a lower level of care, not providing 100% supervision for meals and snacks. Your loved one might say, no, I'm fine, I got it, I'm okay. And they might. So you're just going to sit and enjoy it with them. You're just going to sit and experience it with them as they got it. I tell so many people that I'm like, great, I can't wait to watch you have it. If you got it, that's great. Go have it. I'm just here eating my lunch, watching you have it. But be there. So it's really, really key to have that connection through family meals or however you do that. Make sure you're providing enough structure to help interrupt behaviors. If somebody is really struggling with, you sort of know that they're struggling after meals with whatever the eating disorder behavior is. How can you plan around that? It does take an enormous amount of planning. Like, how can you eat and exercise together? Maybe, following your recommendations of the treatment team. It's okay to ask your child, your loved one, to wait to use the bathroom after a meal, or if they need to go to the bathroom, they get to bring a buddy, you, into the bathroom. That's how it goes. And there are a lot of pieces in treatment that are really uncomfortable, like so uncomfortable. Why does the person have to like suffer the indignity of having somebody have to watch them use the bathroom all the time? It's just where the illness is. And soon that's not going to need to be there. It's not going to last forever. They're going to get to go to the bathroom for so many times in their life alone. Right now, not quite one of them. And that's, again, sensitive and firm. Like, I understand how weird it is that I have to go to the bathroom with you all the time. I get it. It's weird for me too. And it's kind of like you're dizzy all the time, and I'm not going to let you go into the bathroom alone when you're really dizzy, because there's all sorts of hard surfaces you could fall and hit your head on. It's just a thing we have to do right now. Not adhering to the meal plan when you're traveling or having company or special occasions, or like making special things a opportunity to not follow the plan. You can plan all kinds of things ahead of time. You can plan ahead at restaurants. You can plan ahead at going over to somebody's house, going on a trip. You can plan those things. And in early transition time, you need to plan them. That there's a lot of structure. Structure's in. You're going to get your loved one will get to a point where they don't need that structure. You don't need to provide that much structure. They're going to be able to someday eat what they want, not need you to plan it all for them. But right now, they need you to plan it. And then allowing the eating disorder to influence food choices, right? So many families that experience that where the eating disorder is influencing the food choice. It's really like, okay, deep breath. Yep. I'm gonna, gotta engage in distress tolerance for yourself as you experience the distress of having this eating disorder try to take your child's health and happiness and your peace of mind. And so you're gonna, take 5 minutes, you're gonna regroup, you're gonna get support from a family member, you're gonna tag somebody else in there, and you're gonna stay firm and sensitive, like, oh, well, we agreed, this is what we're gonna have, and we'll try that thing another time. We're gonna have this right now. And we can change it in the future, but we're not gonna change it right now. That's where we see in treatment settings too, we see that somebody wants to make a change right at the time of the meal. And it's usually anxiety fueled. If you're getting asked to make an anxiety fueled change, that's a great time to pull out your sensitive firmness and say, like, oh, I hear that you're really anxious. I get that this is scary, and this is what we have planned, so we're going to keep going. And then giving your child choice over food before they're ready. If you're working in a model where you are managing your child's food choices, we want the kids to have choice. We want people to live their own lives independently, making their choices for food out of the, like, this is what I'm hungry for, this is what I'm going to eat. Too often the eating disorder will make a choice based in fear, right? And we don't want to give that sort of room for fear to come in before it's time for the child to make that decision. So really consulting with your team, if you're working with a dietitian, you're working with a therapist, really discuss timing for the autonomy so you can plan that. And your loved one knows when the transition is going to happen. If they're getting out of the hospital or out of day treatment, they might think like, great, now I'm out. Now I get to do the things. They might still have some constraints about what they can do. Couple more of these: returning to physical activity when it's too soon or not taking it slowly enough. Follow the recommendations of your treatment team. There's a lot of, previously we used to have people wait quite a while before we let them engage in physical activity. When I work with my clients, I'm like, you can engage in physical activity whenever you want, as long as you can fuel it. So it's really a both and, like, yeah, you want to get back to cross-country running or skiing or swimming or dance or whatever it is you want to do, that's fantastic. I want you to get back to that too. And turns out that needs a lot of fuel. So you need to fuel that. How are we going to fit that in? You can do it as long as you can fuel it. And that is different than, nope, it's not time yet. Well, what's it going to look like when it's time? Well, you can do it when you can fuel it. What's it going to look like to fuel it? Let's get that figured out, and then you can do it. So really putting those guardrails in. Number 8, I think, is super important, and it's a small thing that's a big thing. Get rid of clothes that don't fit. If your loved one is like, no, I love those pants or that shirt or whatever, if those clothes don't fit, give them away. Give them to somebody else, and don't give them to somebody who your loved one will see wearing those clothes. Don't give them to a sibling if you can help it. I understand that there's some financial constraints that might mean you need to share clothes among siblings. Completely makes sense. If it's an article of clothing that's really sort of part of your loved one's eating disorder experience, don't have it in the house. Get rid of it. Don't give it to somebody that they're going to see wear that. Give it to somebody else. And that people keep clothes. We all tend to do that. Keep clothes that don't fit or we don't really like just free them up for another opportunity that doesn't have to be for you. Can be super powerful. Can be hard to do, but the relief when it's gone can be really palpable. Don't engage in food debates, allowing your child to negotiate the food choices. Again, lovingly firm, sensitive firm. This isn't up for discussion. What will help you get through it? Saying like, here's the line, and I am here to help you get through it. So this meal or snack is not up for discussion. What will help you get through it? How can I support you? I'm so here for you. Inadvertently helping teens body check. Sometimes teens will say like, what is it? Does this look okay on me? Or they'll turn and try to look at something like, what does this look like in the back? Don't engage in those discussions. Like, I hear that you're struggling a little bit right now. How can I, like, what coping skills can you try? What have you learned in treatment that I can help you with right now? Because I'm not going to get involved in whether or not you look okay in that. If it's a question of like, does this look okay? Does this match? Is this appropriate for the event we're going to? Fine. But if it's like, does this look okay? Those body image fueled conversations, do not get into that with your loved one. You can reflect, like, sounds like you might be struggling. I don't know if I'm right. Sounds like you might be struggling. How can I help you? If your child is losing weight, if that's part of the eating disorder, don't let them slip too far. If you notice a weight decrease, bring it to the attention of the team you're working with. I will tell people that, whatever your healthy weight for your own body is, the closer you get to being just right there is like standing on the edge of a cliff. And if it rains a little bit, or if you kick a rock down the cliff, you're going to loosen some of that soil, and pretty soon it's going to erode and you're going to be at risk of falling down the cliff. There is a sort of a biological experience for people when they get too close to a weight that is too low for them, that they just slide right down the slope so quickly. So that, if you, to the degree you can work with the treatment team you're working with, keep your child a little bit away from that cliff and help them to know why. Like, why are you keeping your loved one over here? Because that cliff, the cliff sometimes that sort of cliff imagery helps because nobody wants to fall over a cliff. And that's what it biologically feels like, physiologically feels like when somebody gets too close to that weight that's too low for them, they just slide right on down, and it's fast. And then again, same kind, not taking care of your own needs, becoming exhausted or overstretched, which we all do, but make sure that you have time for self-care. All right, so some words before we get to our questions, some words of advice from people in recovery, people other than me. Ask if I would prefer for you to listen or to give advice. So these are like, from the person. So so your loved one is talking to you. You can say, do you want me to listen or do you want me to give you advice? And you can say like, okay, I've listened. Would it be helpful for me to give you some advice, or should I keep listening? You can check in periodically through the process. But do you want me to listen or do you want me to give you advice, or both? Listening has to always come first before the advice. You can say, I felt similar to what you're feeling when, given an example of like, oh, I feel like based on what you're telling me, I feel like I've felt similarly when I've struggled with making a decision that's super important to me. Or I feel like I feel what you're describing when I've been in this situation, because you don't really know exactly how they feel. You're listening and then you're reflecting back to them like, I think I felt this, and that feels hard. That feels bad. That feels really difficult. I don't quite understand what you're going through right now, but I understand how it feels hard to have that experience. Asking, how can I help you when you're upset? The trick to that is you have to ask them when they're calm. You cannot ask them when they're upset, because usually, I have a 21-year-old, and when I have asked them when they're upset, like, how can I help you? They're like, I don't know. That's not the time to ask when they're upset. Ask when they're calm. Like, hey, next time we get into a bumpy situation and you're upset, how can I help you? And you'd be amazed at how resourceful they are in like, oh, well, this is what you could do. The other question I've learned to ask is to say like, okay, if you were really upset, what would a friend say to you that you'd really value? Like, I've learned more about how to be a better human by asking my kid, like, what do your friends say when you're really upset? I love that. Say, help me understand. Help me understand. I don't quite get it, but could you help me understand this thing I'm trying to understand? I statements like, I feel, I notice, I wonder. It's about you. Don't make it about them. Like, I wonder how it feels to have to eat that, not do that. I notice when this happens, you do this. You can work the you in there, but you got to start with I. Separate me from my eating disorder and express anger at my eating disorder or the eating disorder symptom rather than at me, right? We can all get mad at the eating disorder together. It's sort of like a common thing we can get mad at, but getting mad at each other is when it gets tricky. Talk about things I can look forward to in the future or motivations for recovery, which is also a great thing to talk about when everything's calm. Like, what are we looking forward to when this eating disorder is moved on? What are the things we can all look forward to together? What are the things you look forward to, you're going to look forward to? Give me space when I'm upset, and then come back to it later without forgetting. It's okay to not have to wrap it all up in the moment. You can put a little bookmark in it and be like, well, we can go back to this later. let's move on. It helps people learn to stress tolerance. Like, I don't have to have every negative emotion settled right in the time I feel it. I can let it be there a little bit, and then I can address it later. Do you want me to help you use your grounding skills? Is a great question. Like, because you know what their grounding skills are because you've asked a lot of questions in treatment or you've done a lot of practice together. And so you're like, do you want me to help you with those grounding skills? I've noticed before that when we do the 5, 4, 3, 2, 1 exercise, where you identify 5 things you can see and 4 things you can hear and 3 things you can touch and 2 things you can smell and 1 thing you can, I always forget one of them, taste. That's really helpful. Do you want me to help you practice that? Do you want me to help you breathe? Can I breathe with you? And even I find saying to somebody like, take a deep breath, let's practice your breathing, might work, but also taking a deep breath yourself really helps them to take a deep breath. So if you're feeling that stress, take a breath yourself and then suggest maybe working on breathing activities. And then a couple more, and then we're going to get to, I think we're right at the time for questions. So I think I grabbed this off of the Emily Program Instagram page just as an example of compliments for those in recovery, because sometimes it's helpful to have words like, what words should I say? Even on your toughest days, know that I see your strength shining through. It's a beautiful thing to say. You have what it takes to recover. I believe in you, and I'm going to be here to help you. Facing your triggers takes real courage. It's not easy, but here you are, you're doing it. And most of the time when people are in a really difficult time and there's really high emotions, they're doing the hard thing. It just feels really bad, but they're also doing it. It's beautiful to see you listening and responding to your body with such care. That's going to get you further than I see that you're doing a good job or you look better. I see the progress you're making every day. Trust me that it's there, shaping your path forward. Trust me that it's there. You're there to reflect back to them that it's there. All right, I think we'll pause there. I see we have a couple of questions in the chat that we can dive into.
Yes, I can ask you the questions from the chat. Thank you. As a loved one transitions from inpatient treatment to home, is it okay to use AI for meal plans, or is it part of the process for them to create their own meal plans?
AI has introduced a whole new thing, hasn't it? The great AI pieces I've seen are informed by the person's meal plan. Like if there's any way to give AI any information, like I need to have, here's just an example, like I need to have this many servings of this and this many servings of that and this many servings of that and this many servings of that. Please create me a meal plan. Like give AI the information. That's fine. I would make sure that you're checking it. AI, of course, is not always accurate. Make sure you're checking it with what you know to be true. But using all kinds of resources to help get some variety and some new ideas is great. Just check it.
Great. Thank you. Is there a particular book or other resource you'd recommend that addresses leveraging eating disorder personality traits to support recovery?
I'm going to grab the book right now. It's this book, which is, I'll read you the title. It's called Temperament-Based Therapy with Support for Anorexia Nervosa. It's written by Dr. Laura Hill and 2 other colleagues, Stephanie Peck and Christina Warenga. It's focused on anorexia. So if your loved one doesn't have anorexia nervosa, it still can be really helpful, but just know that it is focused on anorexia. But temperament-based therapy with support for anorexia nervosa, really great way to learn more. And then for a more simple introduction, Laura Hill's TED Talk is really great. It's an older TED Talk, but it's a really great way to start thinking about the neurobiology and the temperament traits.
Great, thank you. Our daughter, 15 years old, is weight recovered and slowly regaining her autonomy, her choice of menu, looser supervision, etc. What pitfalls should we watch for there?
That's a great question. I think the biggest pitfalls are probably that she's 15 and so are her friends probably. That if she's weight restored and she's regaining that autonomy, now life is going to be there to offer her lots of opportunities to practice her skills. And so I would look for ways that you see her or hear her struggle with applying some of those skills and really help her to layer in the things that she knows, whether it's a friend that's dieting or she starts to have some romantic feelings for somebody and is starting to question her body, or that person is, or commenting on her body, even if they're positive comments. But look for the things that are really normal for 15-year-olds to experience and help her to be able to do those things and manage those experiences. That's the beautiful phase of being in those later adolescent years. Life is now going to happen to her in ways that can be overwhelming. So just notice if she gets overwhelmed, notice the behaviors that you used to see, if any of those come back. Talk to her like she's a 15-year-old dealing with 15-year-old stuff, which it's hard to be a 15-year-old. It's hard to be a teenager. It always has been, but it's really difficult with social media. So ask her questions about her social media use, ask her questions about her friends, continue to try to engage in that connection with her so that she can come to you to give you, you'll hear the pitfalls in the stories that she tells you.
Okay, and we have several questions kind of getting at the same theme about how do you support an older teen, someone who's on the verge of adulthood, or if they live alone and you maybe want to go to their house to support them as they transition from inpatient to home. But as it gets increasingly more difficult to actively support and participate in recovery, what's the parent's role?
Yeah, those, and that is such a tough thing that I think one of the hardest parts of transition is when your loved one is either an adult or becoming an adult soon. But I think having those conversations before the transition, to the degree you can, like, hey, you're going home in 3 days, and so how can I help support you? And here are the things that I hear the treatment team say that you would be helpful for you. Can we talk about having those in place? I think it's also, if you can, I know this is not always possible, but if you're can have your 15, 16, 17-year-old agree to let you be involved once they turn 18, to agree to sign that you can see their medical records, that you can be involved, like have them make that agreement as early before they're 18 as you can help you. I know that can be, it's the something happens when somebody turns 18 and they know now they can say no. And a couple of weeks ago, even when they knew they would be able to say no, they're much more likely to say yes to letting you in. So ask before they turn 18 if you can be involved. Those can be helpful. And then continuing to ask, like, how can I be supportive? I know transitions are hard. We don't just take somebody to a brand new city and drop them off on the edge of the road and be like, hi, have a good time. But sometimes that's how people want their families to be in eating disorder treatment. Like, no, I got it. And again, I would say, like, I'm so glad you got it. Like, you're going to have to carry it forever. Like, you're going to have to be you forever. That's awesome because you're awesome. I just want to see you have it and continue to be there. I think that can, you'll know how to approach your loved one best. But to really say, like, if you had some other, like, if you were in a car accident and you broke a bunch of bones and you were in rehab in a hospital for a long time, and then you were going home, I wouldn't just drop you off at your apartment. I would see if you needed groceries, and I would come check on you every day, and I would come in, make sure that your sheets are changed when you need them because you're in a cast. Like, helping people to see that this is the same thing as another illness that they probably would let you help with.
Great, thank you. I think we have time for one last question. This one has some parts to it, but how do you deal with slips when you thought everything was going well and going well for a long time? Especially when your loved one isn't willing to speak to anyone about the thoughts and feelings that they're having.
Yeah. I just had this same question from somebody the other day who's been in recovery for a long time and hadn't told anybody that they were actually slipping. I would say the first thing is to accept that as a gift, that that now you know about it, and hopefully they have told you about it. I mean, you may have discovered it, so they may not have told you about it. Those are two different situations, right? Somebody comes to you and says, I'm having a hard time, or if you discover it. So now you know, and you can use your best sort of I statements and gentle but firm approach, like, I understand that you're struggling, and that makes sense. It happens. And it doesn't mean everything's going to get terrible. It doesn't mean that you haven't done amazing work up until this point. It's normal and happens to people in the process of recovery. How can I help support you? There are all kinds of, there are podcasts out there. There are books. There are, we could go for a walk. We could go have lunch together next week. We could do all kinds of things. How can I support you? Because that's normal. I think the thing you want to avoid is the person feeling guilty, shamed. Those are the feelings that are going to come up, to just let them know, like, you, of course you love them and you're going to be there for them. That happens. Like, try to keep the surprise and the despair that you might feel, which is totally fair that you would feel, inside for the moment, and project to them like, okay, that happens. How are we going to get through this? Like, and then go talk to somebody else about your despair and your surprise, not to them. Really let them know you're there and that it happens, but it's going to be okay.
Thank you. That's right at the end of our time here, so that's so good. Thank you so much. Just a reminder that Feast relies on the generosity of our community to operate all of our services and programs. So if you enjoyed this webinar, or you enjoy any of other Feast services and programs, please go onto our website. The link is there to donate. And also, we'd like to invite you to our next upcoming webinar, which is Wednesday, March 5th, and it is a weight-inclusive, individualized approach for setting recovery weights. Again, we'd love to see you there, and thank you so much to Jillian for being here and for the Emily program for sponsoring us. Really appreciate this information on this topic because it comes up all the time. Hope to see you all next time.
Thanks, everybody.